Hi, my name is Sarah and this is Madeline, and today we are going to be talking about rectal temperatures in our feline patients. The normal temperature for cats is 99.5 to 102.5, and this is really important to do as part of your every physical exam. So we always start with full vitals, including a temperature, and we repeat it. The frequency we repeat it depends on the disease process that they're coming in for. So a cat that comes in really hypothermic might be getting hourly or every hour temperatures until it returns to normal, where a more stable patient or healthy patient may be getting it every 8 to 12 hours because it's not something we're concerned about. One thing to think about is this isn't something that cats like, so if it's not a really important piece of information for us, we don't really need to do it more often because we have to think about their mental well-being and stuff in hospital, and unnecessary treatments should not be performed. So temperature is really important though because it relates to all different body systems, including cardiovascular, renal and hepatic, and it changes if they're hypothermic or hyperthermic. It changes how they eliminate drugs, so it can lead to prolonged recovery if you're doing anesthesia. So it's really important to make sure that they're normothermic. So to actually take the temperature, you should always wear gloves. We use thermometer probes here just because animals do carry diseases and it's easier to clean them between use. So we put a probe cover on there and we then use lubricant every time. This is always a two-person thing. Even if you have a really good cat, this is something that is a little bit scary and uncomfortable for them. So I always have someone holding the head to make sure that you are safe. So we're gonna towel him a little bit because he's a young cat that has places to go. So you just lift the tail a little bit and then you're gonna insert this rectally. Okay, it's in, bud. So you just wait till the timer beeps. Okay, and his temperature is normal, so it means we're not going to check it again because that was kind of hard on him. Sometimes when you check a temperature, you can tell that there is a fecal ball there when you insert it into the rectum. If that's the case, you could get a falsely low temperature. If that's the situation, I sometimes angle the temperature probe just a little bit towards the colon wall to get a more accurate reading. And that's how you check a rectal temperature in a cat.